We will now see or test for if you have a dysfunction in the innominate, in the ilium, which can go anterior rotated or posterior rotated dysfunction. And because the axis is down about S2 here, then it means that if you have an anterior dysfunction, the acetabulum will go down, and if it goes down, you will have a longer leg on the side of the dysfunction. And reverse, if you have a posterior rotated ilium, then the acetabulum will go up and your leg will become shorter. There's a test for that. The test is a downwards test, and the first we have to do is neutral the patient on the table. So you have to make flexion in the hip and the knees and lift up your pelvic and down here and stretch your leg. And then we make here we just make a point here so we can see that the two here is equal. And to test if you have a posterior dysfunction, we make it by we have flexed the knee, we're making a lateral rotation and adduction. And then by here we're using all the pull out of the ligaments and bring the knee and the foot down. And all the time you have to feel that all the ligaments is pulling down the hip. And what you can see here is that after the test, the leg will become longer. If it doesn't become longer, the leg, if it stands like this, it means that ilium, the denominant, will not go down because it's fixed in a posterior position. If we do it reverse, just neutral the patient again, flex, and we can see the 2 points is equal. Then we can test if the patient have an anterior dysfunction. We flex the hip and the knee and bring the hip into a medial rotation, and we bring a little bit of abduction, and then we keep on here to take the leg in a most possible medial rotation of the hip and straight the legs. And what we can see is that the legs become a little bit shorter here. It have to be shorter. We will try again to see if it's enough. Flex, medial and abduction, and keep on stretch the leg. And it become a little bit higher, but it's not much. So what it tells is how much the ilium is possible it can go backwards, because it will take the leg up, because we have pulled out all the string of the ligaments.